2.
Welcome back to Empowerment Nursing. I'm Linda and this is Ashley, and we are nurse educators. You are tuning into our series In the Know, where we make it simple. Today we are talking about something profound, something we all need to consider throughout every step of our nursing journey. Why nursing?
Why nursing? We invite you to subscribe to our live videos so you'll be notified anytime we go online, which is typically multiple times a week. You can also subscribe to us on YouTube. Like and share this nursing video with your friends, because trust me, everybody needs this reminder. Be sure to follow our Facebook page for lots of free content, and you can see all about us on our website at www.N-Powermentnursing.com. So as you all know, Linda and I are both full-time professors of nursing in our day jobs. So we'd kind of like to share with you an important conversation we have with our students. I have this conversation with every group of students that I have the privilege of teaching, and I keep having that throughout their process with me, and especially on their last day with me. And it's a really important, powerful conversation to have, and we see it translate into our everyday interactions with students and with nurses. So it's simple, but it's powerful. And on day one, what I do with them is I ask them what has brought them to nursing school. And I'm not talking about your generic stand up and tell your name to the class and tell everybody why you wanted to be a nurse, because with a generic question, you're going to get a generic response, such as, my grandmother was a nurse, or my mom is a nurse, or I really liked a nurse once, or I really had a bad nurse once and I didn't want to be like that. What I talk about is how I firmly believe that every single person who enters into nursing school has once upon a time envisioned themselves in a moment as a nurse. So that can look different for different people. So maybe you've envisioned yourself holding somebody's hands as they die. Maybe you've envisioned yourself doing chest compressions in a stressful situation to bring life back into a person. I've had the privilege of doing both of those things. Maybe you've envisioned yourself being a part of a woman giving birth to a baby and bringing life into the world. Maybe you've envisioned yourself in the surgical suite assisting a physician with surgery. It can be any number of things. Maybe you've been a patient before and you've been in the bed and you've watched a nurse come in with tubes and needles and vials and thought, wow, it must be so cool to know that stuff. Whatever that vision is, you need to hold on to it. And as nursing school gets stressful, because it will, as nursing school gets negative, because it will, as nursing school gets overwhelming, because it will, you need to hold on to that moment. So as you are putting in your clinical hours and studying for final exams and completing clinical assignments and reflective journals, right? You have to keep going back to that end game. Keep remembering why it is you've come here. As you experience maybe a negative culture of nursing, you have to remember that moment you envisioned yourself in so you can see through all of those challenges. Then on the last day with us, I asked them again, do you remember that moment we talked about on day one of nursing school at orientation, of how you envisioned yourself? Maybe you've had the privilege as a student to be in that moment, and that was really validating. Maybe that hasn't happened for you yet. Maybe that moment's changed. Hopefully it's evolved if you've allowed yourself to transform through the process of education, if you're open to that. But the most important thing is that you don't get lost in the assignments and the studying and all of those things, and you kind of lose sight of the vision of where you saw yourself. You're so excited on day one of nursing school. Everybody's so excited, right? It's taking that excitement with you through graduation and writing your registration exam and then practicing as a nurse. That's what's important.
This also applies to the study process. Yes, you're studying with us to pass the registration exam. That is the obvious end goal. But surprisingly, if you read our reviews on Facebook, you will notice that graduates, yes, they're happy, extremely happy that they passed their exam, but more importantly, they're thankful that they've rediscovered their why in preparing with us and bringing them back to what was important, to that place, teaching them in passionate ways that improve their confidence and their competence at the bedside. And in doing this, it has decreased their fear, their entry to practice fear, and then that steadies them through getting through the fear of studying for the registration exam and writing that exam. You are studying to save lives. You are not studying to simply pass, but to hold on to your confidence and your competence so that you can continue to touch vulnerable lives in your practice. So you are studying ultimately to save lives.
Or to change lives,
Yeah,
right? To
absolutely.
simply change lives. You don't necessarily, it doesn't
Or
need,
to
not
touch
everybody
lives.
needs savings, right? Not
To
everybody
touch.
needs saving.
Yeah.
Some of the most rewarding things about the work that we do with graduates, of course, we want everybody to pass. Of course, we love the fact that we have a 99% pass rate that includes people who have been previously unsuccessful multiple times before coming to our program. We love data, so we love that stat. But what we love most and what we find most rewarding, believe it or not, is when we receive emails or messages days, weeks, months, even years later from graduates who took our program that are like, hey, just wanted to let you know that yesterday I had a horrible shift and I had this critical situation with a patient, and because of the way you taught me acid base, for example, I knew exactly what was going wrong. I knew exactly what needed to be done. I acted immediately. I managed to save this person's life. Or because of the story you told around this, I managed to touch somebody's life in a very vulnerable situation. Or, you know, I can't believe 3 years later I still take your textbook with me to work and I use it as a resource with all of my patients before I start my shift. That's to us what is, I would venture to say, the most rewarding, because to us also it's not just about helping students pass, right? It's about changing the culture of nursing, changing your experience. That's what's really near and dear to our hearts. So nursing school is hard. Passing your registration exam is hard. Being a nurse is hard. It's all hard. But it's also worth it. And it's really, really important that you hold on to that moment you envisioned yourself in that very first day you were sitting in the chair as a nursing student. I also say to my students, never forget how much you don't know right now. Because it's easy as a nurse when you have all of the knowledge to then judge patients for not having it. But you can't ever forget how much you didn't know on your very first day of nursing school and how much of a gift the knowledge you've gained over the process really is. It's a gift. And our privilege in this profession is to share it with other people. That's why it's so profound. So remember your end game, right? Remember the reason why you started. The process is about so much more than passing. What we do is about so much more than passing. Our program's much bigger than passing, right? People come to us to pass, but they leave us and we stay with them for reasons other than that. It's really easy to lose the goal of being in the process of becoming. So just hold on to that.
If you're looking to gain all the content, confidence, and critical thinking and fun, you need to pass your NCLEX CPNRE exam. We have complete NCLEX, NCLEX-PN, and CPNRE course packages. We guarantee you will pass or your money back. Thank you so much for joining us. We'll see you next time on In the Know. Bye for now.
Adios.